Hey, now we are coming to the concluding session of this integumentary system. So the last topic which we are going to discuss is the breast, human breast. Frankly speaking, this should be placed under the female genital or the female reproductive system. But even breast, it's classified under the CPT as a integumentary section. Okay. Now let's think of a woman who has a problem, who is approaching a provider. Okay. So maybe she might be having a kind of a lump, right? Or she might say, I have pain in my breast. She's approaching a doctor, and the doctor, what he does is he just orders this lady to take a X-ray, which is a mammography. So there they can, if they suspect any lesion, it can be visualized, right? So mammography is basically an radiological examination of the breast. So after that, imagine the doctor is finding that there is a lesion in the breast. So then the doctor goes for a biopsy. He would suggest the patient to go for a biopsy. So this biopsy, it can be done in two ways, as an open biopsy or a percutaneous biopsy. In an open biopsy, a cut, an incision is being made into the breast, and thereby the tissue is examined for, then submitted for a pathological evaluation. In a percutaneous biopsy, the physician is just going to pass a needle into the breast with the aid of some imaging guidance. As we discussed earlier, some of these imaging guidance are, as we all know, it is stereotactic, mammographic, MRI, or an ultrasound guidance. So we have codes without imaging guidance and with imaging guidance. Okay, the patient has been diagnosed with a particular tumor or whatever, or a cancer. So the patient will be now scheduled for a, either for a radiotherapy, or she will be scheduled for a surgical excision like a mastectomy. So for that, what happens is the radiologist, he places a localization device, some wires, metals or pellets or clips into the, because we have the breast. So 6 o'clock position, 7 o'clock, you can divide the breast into the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant, 9 o'clock position, because you need to figure out where exactly the cancerous or the suspicious tissue is.